Thank you, Frank. Good afternoon, everybody. My name is Shreya Koirala. I am the Public Health Program Coordinator for Hepatitis B Foundation. I'm very excited to welcome you all to today's webinar, where our 2023-2024 mini grantees will be showcasing their mini grant project. Moving along. Before we get started with today's session, a couple of housekeeping items. All our attendees are on mute. If you have a question during our session today, please use the Q&A box that you can see at the bottom of your window. We will make note of all your questions and we will be asking our panelists those questions once all the presentations are over. We also have a chat function. Please feel free to introduce yourself. This session is being recorded. We will be sharing the recording as well as the slide presentations with everybody in the next few weeks. A little bit about Happy United. Happy United is a national coalition dedicated to reducing the health disparities associated with hepatitis B by increasing awareness, screening, vaccination, and linkage to care for high-risk communities across the United States. We have 60 plus local coalitions and national organizations in 36 cities and 26 states and DC. If you want to know more about Happy United or want to become a partner, please feel free to reach out to myself or Frank, who's the director of Happy United, and we will be happy to chat with you. We'll be dropping our emails in the chat in the next few minutes. So feel free to use that. Before we get underway with our presentations, a little bit about the HBU mini grant program. HBU's mini grant program focuses on programs that address hepatitis B among African immigrant, Asian American, Native Hawaiian, Pacific Islanders, communities, and persons who use drugs. Since 2014, we have distributed more than $600,000 to 18 states, supporting local partners to increase their capacity and increase screening, education, vaccination, and linkage to care. If anyone in our attendees are working with organizations that work on addressing hepatitis B in their communities, we encourage you to fill out a mini grant application. We recently concluded our 2024-25 application cycle, but our next mini grant cycle should be opening in February 2025. So please keep an eye out for that. And if you have questions about it, again, please feel free to reach out to either Frank or me, and we'll be happy to answer your questions. For our 2023 and 24 mini grant cycle, we awarded 7 mini grants to these organizations: Drexel Hope, Hepatitis B Initiative of DC, Hope Clinic, Asian American Community Services, Korean Community Services of New York, the African Family Health Organization, and SF Hep B Free. We are joined by all of them today, and they will be talking about their mini grant project. Without further ado, I invite Shane Chen from Hope Clinic to talk about their mini grant project. So I'm going to stop sharing. Take it away, Shane.
Thank you, Shreya. Okay, here we go. And then, can you see the slides okay? All right. Good afternoon. My name is Shane Chen. I'm with the Hope Clinic in Houston, Texas. We are actually established as the Asian American Health Coalition of Greater Houston, but we founded our community health center in 2002. Oh, excuse me, 2002. So our mission is to provide quality health care without prejudice to all of Greater Houston in a cultural and linguistically manner. So as a health coalition, we do a lot of advocacy. We had been working with Hep B United for quite a long time. In fact, since I want to say late 2000s, in order to be able to start addressing hepatitis issues, hepatitis and liver issues in the Greater Houston area, with the movement to push for vaccination, push for better testing, push for more understanding. With that, we became a federally qualified health center in 2012. Oh, excuse me. And then the services that we provide right now is very, very comprehensive. It's primary health services from womb to tomb, from birth all the way to the elderly. And then we also provide women's health services, including OB-GYN services, and we do our own delivery. We have behavioral health, nutrition, eye clinic, dental clinic. With that, the supplemental services that we have is actually very comprehensive, very comprehensive, which also include having a pharmacy that we recently established, in-house pharmacy, providing the 340B patient assistant, but basically low cost medication for those in need. And we do provide them with medication assistant services as well. And I'm going to talk about that momentarily with this hepatitis project. We had actually gotten a lot of guidance and assistance from Hep B United, as well as some of the national health centers, such as Charles B. Wang, as well as Asian Health Services in Oakland, California, to be able to learn for our primary care provider to learn how to do hepatitis B and C management. With that, we gradually build our capacity. But with this particular grant funding cycle, we were targeting going back to the roots and really doing a lot of education, a lot of outreach, and doing kind of an assessment where we stand right now, especially doing a focus group for those family and patient who are currently going through hepatitis B. We noticed during the COVID, the many years of COVID, we had actually kind of dropped a lot because we shifted all of our focus on COVID. And so our hepatitis B patients has not really gotten a lot of the navigation and the more hands-on guidance that they needed. So we wanted to go back to the roots and really do a lot of the education outreach, as well as testing and patient support. Our patient is very multi-ethnic. Over the years, we've actually gone from the higher level of Asians all the way gradually, because of the Asian American Health Coalition route, being able to anchor ourselves in the different populations as well. So our Hispanic population grew, and we're more representative of the current Houston demographics, which included a lot of the immigrants, since we are in the border of Mexico and the US, as well as many of the incoming refugees. So recently we've been seeing a good number of Afghans. We still see a good number of those from Burma and many from Africa, which are highly prevalent for hepatitis B. So we're very mindful of the patient, where they're from, their origin, as well as needing to continuously outreach and educate, especially if they're coming from countries that are that has high rates of hepatitis transmission. This is kind of a scope of like a ballpark of where the patients are from, but we also have patients coming from different other cities, out of state, coming over to access care from Houston area. We have 5 locations currently, 1 school-based anchored at a middle school, and then we have 1 anchored in the Asiatown area of where we pretty much started from, but we pretty much provided health services in over 30 different languages. We actually hired staff from within the community. We actually make sure that our staffs are well trained on different health condition, chronic issues, so that they became our liaison, and they also provide the care and also become the bridge to the hard to reach population. With that said, many of our populations are, again, immigrants. They are also very low health literacy. So the understanding of anchoring a health home, why it's so critical to come to the health appointment in the 3 months, 6 months to get your viral load checked, is actually kind of sometimes lost in translation, because in their mind, primary health care is actually more sick visit. I come to see you when I'm not feeling good. I come to see you mainly because I need my medication refill, as opposed to I come to see you to stay healthy. So we're still backtracking and working on a lot of the health and information, educating about like the patient provider relationship and the importance of, taking charge of their own health. And then, so going back again, because of the diversity, these are kind of like the breakdown of the top 10 languages other than English. And then, so we actually have people from the immigrants from different countries that has different dialects. So just because you say Chinese, or even if you basically said the Burmese, each country may have different dialects, which then does not allow you with that one staff to communicate in that languages. So you have to be prepared to have things in different contents, in different characters, to make sure you're inclusive of that person from that particular country. So I definitely wanted to actually kind of highlight where we had actually made a huge difference. I have to say, from the beginning of this whole journey of hepatitis management, one of the things that we really advocated for was how do we really engage our providers? So part of this journey, including doing focus group, doing education, we had family medicine residents in collaboration with the University of Houston Medical School. And so along the way, we've actually really embedded the importance of going out to do education, the importance of really understanding the low health literacy, the needs of the community, as well as how to engage them and manage hepatitis. So we graduated, I want to say about 30, 32, 33 different family medicine residents that are actually trained on how to test for hepatitis B, encourage vaccination, as well as manage for those who are positive. So they're now in the workforce, being able to, at the community health level or at the primary health level, being able to keep the cost low for family and the uninsured and underinsured individuals. So for our project, the number of education kind of gradually phased, dropped, especially during COVID, but we kind of are intentionally like picking it back up, especially with the changes and of the political climate. We started seeing more immigrants as well and more refugees settling in Houston, Greater Houston. So we use this opportunity to collaborate with our Health and Human Service Department, really work with our refugee resettlement agencies and the different Asian American and other churches and organizations to be able to start reaching to their members. And so the testing itself, we were able to also leverage a little bit of resources from the National Association Community Health Center, NAC, to be able to cover some of the testing costs, mainly because aside from the hepatitis, then people, when you're actually mentioning hepatitis, people start questioning, well, what about this test? What about that test? What about HIV? Right? So we're intentionally meaningful having that conversation. Okay, well, this is the reason why you need to be tested for hepatitis B, but okay, you need this other certain test. We'll find you resources, and we're leveraging the additional services to go along with that. The top languages that we reached out to definitely is Vietnamese, Chinese, the different dialects of Burmese, including Rohingyan. We do have significant amount of the Rohingya population living around our clinic in the Asia town. The Hindu, Pashto, Dari, Arabic is one of our larger language that we've reached out to as well. English, Spanish, Korean, and Urdu. And then we're still in the process of conducting the focus group to the patients as well as their family member, their caregivers. So right now we don't have data to share just yet. We may be towards the latter part of this year after we finish all the analytics. But some of the focus group that we conducted are reaching out to the Vietnamese population, which Houston has one of the bigger Houston Vietnamese settlement. The Chinese population, the Spanish, as well as the Burmese. And we're still kind of assessing the different groups that we have right now, including maybe some one of the African countries, to be able to conduct a focus group there as well. What we figured is if we conduct the focus group and get feedback from them, we're able to actually provide better services, right? In a sense, you're also kind of assessing, hey, how are we doing in the areas of providing you access to medication? Access to the hepatitis, understanding your hepatitis status, and also understanding that you the cost of it, the feasibility of getting the medication. I mean, along the journey, we were able to kind of find a lot of the barriers that patients faced, including like the ones who have Medicare, the ones who are the elderly, who basically are not eligible anymore because they have insurance. They're not eligible anymore to get patient assistance program from the for the pharmas. Now that actually creates a lot of barriers for elderly seniors who cannot afford $500, $400 per month in order to be able to pay for their copay. So we're advocating using that as a platform to advocate as well. In another sense, we're actually also learning about healthy eating, because the thing is, it's also talking about liver health. Oh, goodness sakes. liver health. And so ultimately, when you're talking to patients about, hey, don't drink alcohol. This is how you should stay healthy. We'll try to keep your liver as healthy as possible by using medication and whatnot. We're also mindful that then how do you stay healthy? The lifestyle aspect, and then also what food, vegetables, and whatnot that you can actually incorporate into your lifestyle to also promote healthier liver, with to reduce the fatty liver issues that may actually contribute to other liver complication down the road. So we actually utilize our culinary program that is actually led by a culinary chef, as well as a registered dietitian, to also spearhead some education sessions about using healthy vegetable and fruit in their culturally competent recipe, to be able to also have a healthier meal to kind of reduce inflammations, fatty liver diseases, and whatnot. And this is one of the slides that we have one of our residents, along with our chef, at a Vietnamese Buddhist temple to really reach out about healthy eating, as well as educate about hepatitis. Thank you.
Thank you so much for that, Shane. Next up, we have Karen Chiobu and Tian Ma from AACS talking about their mini grant project. Take it away, Karen.
I am Karen Jobu from Asian American Community Services, which is a social services since 1976. And we provide a section called Healthcare and Prevention, which I am an advisor for. We also have a free clinic, and we do community screenings. This hepatitis B mini grant has to do with these community screenings that we do. The overreaching goal for this project was to provide hepatitis B awareness, education, screening, and immunization, and linkage to care to the Asian-born and African-born communities in Central Ohio. The objectives has been to idea and develop systems and strategies to educate communities and providers and implement new universal hepatitis B vaccination recommendations. We've used the community health worker, community churches, temples, and mosque gatherings to do these screenings. We provide Hep B education. We plan to provide Hep B education to 200 Asian-born and African-born participants, and to provide screening and immunization and linkage to groups for 4 groups, 2 Asian-born and 2 African-born, and plan to have 160 screened. For the African communities, the activities have been the Somali Health Fair, which we have been, before COVID, been doing an annual health fair in their community with Hibo Noor of Columbus Public Health. We also did a screening with the Nigerian in Diaspora Organization and CPH on July 27th at the Columbus African Festival. And we are planning to look into the Ethiopian Tawanda Social Services. They provided us a letter of support, as well as the Liberian community. Here are some pictures from the Somali Health Fair. Photos from the from the Columbus African Festival. Actually, this lady here was going around with a microphone and interviewing the booth, as well as had asked me why I was here. So I got a chance to do a little education and awareness. We also are looking at the different data points. And here we have a list of the African countries where we had participants. So this map shows you the density. It's primarily Somali so far. So as far as the Asian communities, we had the Asian Festival on May 25th, 26th. We did 2 trainings for the community health workers that educate and bring participants to the festival. On July 20th, we did a Korean Train the Trainer, and then that led to a screening on August 18. We plan to do a Filipino Train the Trainer for a local Philippine organization, as well as the Philippine Medical Technologists group in Indiana. That resulted because we had medtechs at the Asian Festival who provided medical technologist volunteers to help us help draw blood at our festival. Oh, wait a second. I think, did I show you this? Okay. So these are some of the photos that were from the Asian Festival. We get a lot of volunteers from the medical students at the Asian at the OSU, as well as there's a group called OSU Community Health Education Medical Students. They're first-year medical students that send us about 6 to 7 medical technologists, not medical students who help us with our project. The Korean community screening sort of came up. So we don't have photos of it, but the community health worker that helped us with this made this flyer, which she took to all the churches, all the Korean churches, the groceries, as well as others. And then she pulled up this flyer from CDC in Korean for hepatitis B. We also did the same thing, looking at the results of the whether they were immune vaccine eligible or infected. And so this is the map of the areas and density of the participants from the Asian community. The other thing that we were going to do on this project was to provide the first vaccine at the festivals, and using the 2-dose vaccine by Dynavax. Early on, we found that the Columbus Public Health, we would refer vaccine eligibles to for free vaccinations, was short on vaccine. And so they asked us not to send coupons to people that were vaccine eligible, and to call the Columbus Public Health for vaccines. Recently, we were able to meet a representative for Dynavax to explain this process, where we were going to try to do the first vaccine at the festival or at the event, and then 1 month later have the person come back to our free clinic to get the second vaccine. We found that when we were sending to Columbus Public Health, that only 20% of those made it, the vaccine eligibles made it to have the vaccine. And so therefore we were going to try this method. It sounds promising. The person was interested, but he had to take this up to his leadership in order to have approval for any monetary support or for the vaccine. The other thing we were going to do in this project was research the use of the point-of-care Hep B antigen at the screening. We're in the process of doing a cost analysis of that. What we're finding is that in the United States, this may not be cost effective because we get results fairly quickly. However, I'm thinking that if there would be a point of care Hep B antibody, that would probably make, you could do the screen for antibody. And if they are positive, you don't have to do the first dose. If you have a negative, then you would vaccinate. So we'll be looking at the cost analysis of that. So the successes so far has been the Korean Train the Trainer led to the screening event for Hep B and TB, and really focused on the use of this community health worker or the value of the community health worker in providing this. The second was networking with Columbus Public Health and NIDO. This was the first time, well, after the Somalis, that we had gone into another African group here. At the Asian Festival, we were able to do 118 hepatitis B for the 2-day festival. And then the contact with Dynavax is very promising, and we hope that we will be able to, in future screenings, try this out. We didn't get very many participants for the Columbus African Festival, but the chairperson said that we could send Hep B education to their through their listserv. So we're working on that. And then I did get some publicity out through the African lady who interviewed me at the festival. So that's where we are with our project. Thank you.
Thank you so much, Karen, for the incredible work that you all do. Moving along, we have Korean Community Services of New York. I invite Sarah to talk about their project.
Hi. Good afternoon, everyone. My name is Sarah Kim. I'm the program director at Korean Community Services in Metropolitan New York. Today, I will present our work as a grantee of Happy United Foundation for the past 2023-24 grant year. I will cover our organization's project overview, key deliverables, successes, and challenges, and our plans moving forward. I want to take a moment to introduce you to the Korean Community Services, called by KCS. Founded in 1973, KCS is a nonprofit organization dedicated to serving underrepresented populations with a particular focus on Korean immigrant community and the broader Asian American and Pacific Island communities. Over the 51 years, KCS has expanded its services to meet the diverse needs of our community. Today, we offer a comprehensive array of client-tailored services across several critical areas. These include aging, education, immigration and legal services, workforce development, public health and research center, and state licensed mental health clinic. I work for a public health and research center. Recognizing the unique health challenges faced by immigrants, we added the the Public Health and Research Center to our organization back in 1986. This center was established to address the specific health needs and concerns within our community. One of our key initiatives began in 2007 in collaboration with NYU's Center for the Study of Asian American Health, called by CISHA. Together, we launched the program focused on hepatitis B, which has since become an essential part of our public health effort. At the KCS, Public Health and Research Center, at the KCS Public Health and Research Center, we are dedicated to serving our communities by providing crucial access to healthcare services. Our efforts focus on health education for prevention and self-management, ensuring that individuals have the knowledge they need to take control of their health. We also offer screening and linkage to care, participate in important research studies, and engage in advocacy to support the needs of our community members. Our services are available across several key locations, including western and eastern part of Queens, Bayside, Flushing, Corona, and then Manhattan Borough. In our office is in Koreatown, and we expanded our services 2012 for Lee Palisade Park. Both towns are under Bergen County. This is a project overview. Regarding the Happy United Foundation project, our objective was to increase access to educational and medical resources within target populations. Particularly focusing on hepatitis B. We have been working on various activities, including educating and screening individuals for Hep B, engaging a broader audience through media, and establishing new vaccination partnership sites and creating educational materials in multiple languages to ensure accessibility for all. Key deliverables. In terms of key deliverables, we have successfully provided education to more than 30 individuals and screened more than people for viral hepatitis B, antigen antibody, and core antibody. Through our media outreach efforts, we have managed to reach 1,200 people with crucial information about Hep B. Additionally, we have established 4 new vaccination partnerships aimed at uninsured populations. We have also created and translated educational materials into multiple languages such as Punjabi Hindi, Korean, simplified Chinese, traditional Chinese, and English to better serve our diverse community members. These are successes and challenges. We are very proud to share some of our successes. So far, we have hosted 9 community health events with 1 more scheduled for September. We have tested 85 people and identified 3 individuals with chronic viral hepatitis B who were promptly referred to linkage to care. Our partnerships have been very instrumental, particularly with the United States, which allowed us to test more people by providing language support and education. We have also partnered with Northwell Hospital, Charles B. Wang Federally Qualified Health Center, and Main Street Radiology for additional screenings and vaccinations. Lastly, we initiated a successful HBV monthly patient support group in February by inviting Dr. James Park, a hepatologist, the director of Asian Liver Center of Northwell Health, offering crucial information to our Korean patients. Challenges. Of course, we have faced our share of challenges. Creating vaccination sites has been difficult since we are not a health clinic. We have had to rely heavily on partners like Charles B. Wang, Community Health Clinic, or other community-based community clinics. Another significant challenges has been the translation of educational materials. The process has been slow due to a lack of resources and staff speaking Hindi or Punjabi. For example, while we have completed the Hindi translation of our faith-based organization toolkit, the Punjabi translation still in progress. Future plans. Looking forward, we are committed to sustainability and continuing our efforts to meet New York City Department of Health's goal to eliminate viral hepatitis by 2030. We plan to expand our Hep testing services to include more of the Chinese and South Asian populations. We also aim to extend our services to New Jersey, focusing on Central New Jersey and Bergen County. We will continue our advocacy efforts and education efforts with the New York City Council members to secure ongoing funding effort. In summary, KCS remains committed to expanding happy education, screening, vaccination services, even as we navigate challenges. Our partnerships, community engagement, and advocacy efforts are essential to our ongoing successes. Thank you for your attention, and I'm very happy to take any questions. Thank you.
Thank you so much, Sarah. Next, we have Diane from AFAHO going. Diane, I will share your slides in a second. Can you all see my screen?
Yes.
Awesome.
Keep it in presenter mode or presentation.
Yes.
So, hi everyone, good afternoon. My name is Dion Uwayo. I'm the Health and Social Services Manager at the African Family Health Organization. Next. A little bit about our history. We were founded in 2005 with a small grant from the city of Philadelphia to support community members living with HIV/AIDS. But since then, our organization has really grown to provide health, social, and educational services, again, to the greater Philadelphia African and Caribbean community. Our staff is almost entirely comprised of African and Caribbean immigrants and refugees, myself included, and we come from a multitude of different countries and speak about 16 languages here in the office, which is a really beautiful thing to see and be a part of. Next. As shared, our client focus is really the African and Caribbean immigrant and refugee community of Greater Philadelphia. Next. So thinking about country of origin, where our clients come from, as you can see, a majority of our clients come from countries that we know have high rates of Hep B, West Africa, Mali, Guinea, Ivory Coast, Togo, as well as Central Africa and Haiti as well. Next. And I just wanted to share that our clients bring so much to the city of Philadelphia in terms of culture, ingenuity, and knowledge. A lot to be gained from them, but they also face immense challenges and barriers to accessing healthcare. Some are listed here. For our folks, about 70% of the clients we work with are uninsured or uninsurable, and 50% and growing are undocumented. And these are very real barriers that we, as an organization, try to support clients overcome when seeking healthcare and social services. Next. So a little bit about our Hep B mini grant. So AFAHO's hepatitis B work is rooted in its over 10-year partnership with Hep B United. In many ways, the grant activities, which I'll speak to in a little bit, could not have been successful without this firm foundation. Initially, the partnership began with health education and training to our cultural health navigators or case managers. These are our staff who really work directly in the community. I have a picture of two of them here, Sally Matu and Dr. Afisat, who have been with the AFAHO for some time. And through their on-the-ground efforts, there has been an increase in our community's willingness to be screened for hepatitis B. For example, in 2022, we connected many community members to the screening, and we found immensely high positivity rates that range from 6 to 15%, depending on our screening events. And, truly with this mini grant, we were really eager to expand our capacity and be even more intentional about our efforts to educate our community, screen, vaccinate, and link community members to care. Next. So our stated goals and activities for this mini grant was to, 1, increase community awareness and knowledge of hepatitis B via focus group discussions, which we really wanted to understand with these focus groups, community perceptions of hepatitis B and barriers to care and screening. We were also interested in understanding the ways in which stigma is associated with Hep B and how that might manifest in our community. And also if community members were aware of this link between hepatitis B and liver cancer, which we think is a very important public health link to be known. We also plan to draw from those focus groups to develop a comprehensive, culturally sensitive Hep B educational workshop to deliver to community members as well. And then with our second goal, we really wanted to connect community members to Hep B screening, vaccination, and link them to care via our 2 flagship large health screening day events that we host every year and other mini events that we also host throughout the year. Next. So how did we do our findings? So we were able to complete a series of focus groups with about 33 community members. And the focus groups really revealed a general lack of knowledge about how Hep B affects the body and how it spreads. And speaking about how folks talk about hepatitis B, some of them refer to it by one of its symptoms, jaundice. And so folks knew it as jaundice. Other folks had heard the term Hep B, and then others had not at all heard about Hep B. We also heard about limited experiences of stigma and discrimination against those with Hep B, particularly in clients' home countries, so back home. One participant in the Arabic-speaking focus group shared that she witnessed maltreatment of patients with Hep B by nursing staff in her teaching hospital, which was interesting to hear about. And then other community members shared they felt it was really necessary to be extremely careful when engaging with those they know to have Hep B, particularly with regards to eating together and sharing bathrooms. So really from these focus groups, it was clear that we needed more education to our community about Hep B, how it transmits, and just, general knowledge about hepatitis B and screening. And this led to our workshops, which we developed again from our focus group discussion findings, and we conducted in a multitude of languages as listed here. The workshops were also really informed by the Hep B community flip chart and the Just Be storytelling campaign. And just to plug here, it's been a blessing to not have to recreate the wheel when we're doing this education. There are so many great resources already developed by Hep B United and Hep B Foundation. So we definitely utilize those in our education. With our workshops, in addition to general knowledge of Hep B, we also found it really important to add a self-advocacy module to really inform and practice with clients how to ask their doctors for the Hep B screening and how to be better prepared to engage with providers about Hep B if they're positive. And so that was something we added to our workshop. And generally, we found the workshops to be highly engaging and successful. We put in place this pre and post test to really measure knowledge change or knowledge gained. And as you can see, overall post-test scores were higher than pre-test, really showing that folks gained some knowledge from the workshop about hepatitis B. Next. A little bit small text there, but throughout the year, we also connected clients to screenings and vaccines via our partnership with Hep B Foundation, who provided the screenings, and Philadelphia Department of Public Health, who provided the vaccines. We had a small mini men's health screening day early this year. We were able to screen about 53 folks. Then had our large Northeast Health Screening Day in the spring, and then we have one more screening day coming up in October, which again, we hope to continue to screen and vaccinate our folks, as well as connect those who are positive to care. That is critically important for us, not to just screen, but connect folks to care. And these are some pictures here of our screening day events, which are definitely the highlight of our year. Next. And so just thinking about challenges, access to care still can be a challenge. What has been successful for us in the past is really having a champion at the health centers and federally qualified health centers that we send our clients to. And we've had that, but most recently, one champion at one of our health centers has left, and so that's one of our challenge to really make sure our folks are connected and really have someone looking out for them at the health center. That's something we continue to work on. Access to vaccines is always not always also available through the city, or there's a limited supply, and so we are really working with the Philadelphia Department of Health to make sure that before our events and our screenings that they are able to come out and able to have like enough vaccines for our folks. And then lastly, perhaps more impactfully, is the situation that Philadelphia and other large cities are finding themselves in at the moment, which is really large numbers of asylum-seeking individuals resettling into the city. Since last fall in Philadelphia alone, over 1,000 African and Haitian asylum seekers, predominantly young men, have come to the city. And as a FAHO, as an organization, we really had to pivot some of our work to address their most basic needs, like food, shelter, and clothing. And so that delayed some of our activities for this grant, but thankfully we were able to get back on track. But more importantly, it really also made us think about how we can best reach this new and growing population of folks with regards to education and screenings and vaccination. And that's what we're really working on now, developing materials in some new key languages, such as Sonaki and Fulani, engaging religious leaders, including imams who have really been critical in the migrant response, and then also developing educational videos that can be viewed by these community members who are often in transit and often looking for work and might not be able to come to our in-person workshops, which we've been doing with community members who are kind of a little bit more settled in the city. And so that's what we're envisioning for the future. Yeah, and with that, just wanted to say thank you for carving out time to hear about our hepatitis B work, and looking forward to answering any questions.
Thank you so much, Diane. Just an FYI, we may go a few minutes past the hour since we have 3 more folks to go, but please keep asking your questions. We'll get our panelists their questions and we'll be sending that out with our recording, answers to those questions via recording. Next up, we have Dr. Nick Seval from Drexel Hope talking about their mini grant project. Dr. Seval, I have your presentation lined up. I'll be sharing my screen. Just give me a few seconds.
Great, thanks so much, Shreya. And Rachel Fox and I will be presenting together. And yeah, whenever you're ready.
Can you see my screen?
Yeah, that's great. Thank you, Shreya.
Go ahead.
Hi, everyone. I'm Rachel Fox. I'm one of the co-directors of Drexel Hope, along with Dr. Nick Seval. We are the mobile branch of a Ryan White funded clinic that's housed within the Drexel University College of Medicine in Philadelphia. Next slide. So the mission of Drexel Hope is a mobile medical unit working to reduce racial health disparities by bringing treatment for opioid use disorder, HIV, and viral hepatitis directly to zip codes where drug overdose rates are highest among Black and Latinx Philadelphians. So we receive data from the city, overdose data from the city, and then we bring our mobile unit to those neighborhoods. And we rotate every several months our location based on how many people are walking up to our unit, from word of mouth of what we hear from our patients in terms of where the highest need is. And being mobile is we can reach so many more people that way. So that's been really wonderful. Our team consists of 3 medical providers, a program manager, a licensed clinical social worker, and 2 peer recovery specialists. And the services our program has offered for the last 5 years are Suboxone induction and linkage to longitudinal care, Narcan distribution and training, HIV and Hep C rapid testing, PrEP and PEP, wound care, gender affirming care, contraception, and harm reduction supplies. So our population of focus is folks who use drugs. Most of our population has unstable housing. Many of them have been incarcerated, and several have recently been incarcerated. And a lot of them are just really struggling with day-to-day survival and how to survive street violence and all of the things that come along with that. Next slide, Shreya. So I'll turn it over to Dr. Saval, but thanks to this mini grant, we were able to integrate hepatitis B services for the first time into our program this past November.
Yeah, absolutely. And you can go to the next slide, Shreya. You know, I'll talk about some of our work now, being a Hep B mini grant awardee, and our Hep B service expansion really has been a part of a larger viral hepatitis management initiative that's been supported by grants like this and some other grants that we've received. And these initiatives coalesced and really began in earnest late 2023. And here's a bit of a roadmap of what we've tried to do. And the cornerstone of this has really been to have a hepatitis nurse manager on the van. And so she's been, as listed here, a nurse navigator, Kim Burkhart, a point person for education, testing, linkage to prevention and to treatment. And they've really taken ownership of this. The goal was to really own it throughout the cascade of care. This has all been paired with education for all of our Drexel Hope team members about understanding viral hepatitis basics and getting up to speed for our medical providers, in terms of learning updated treatment for hepatitis C, but also updated screening practices for Hep B, and some of the more novel vaccination strategies that are recommended from a public health standpoint for Hep B. You know, one of the more important interventions for all of this is that historically, you know, in the past 3 years for the Drexel Hope Mobile Health Unit, our Hep testing and HIV testing has been point of care. And as this group and the audience knows, really you need phlebotomy to figure out what's going on for someone's Hep B serostatus. So this was a big part of our intervention over the past year to really get a full sense of someone's Hep B serostatus, together Hep A and C, and HIV testing. And this was happening on site at our mobile unit, where our nurse navigator was present for all of our sessions, but also at community events. And this was part of our goal as a mini grant awardee to reach populations at times outside those who use drugs. And then kind of associated with all this was really completing prevention or treatment cascades, be it vaccination or Hep C treatment, entirely from the mobile health unit. Next slide. A bit about how our flow works. Our van is on site at 2 different locations in Philly, South Philly and West Philly currently. 1 day a week for each of those sites, so Tuesdays and Thursdays when put together. Our peers, as Rachel had mentioned, are really a huge, important part of this team and do weekly outreach, education in the community, and bring folks in and keep in touch with people. Referrals come in from community partners, clients, and organizations. There's a medical visit and intake. And as part of this expansion, we really implemented opt-out lab draws for all folks coming in for their intakes, including for their Hep B serostatus, really kind of providing screening that didn't exist before on the van. This is together with some of the other wraparound care that we offer, which is screening for psychosocial needs. There's a social worker on the van, screening for mental health needs, and kind of an original core provision, which is treatment of opioid use disorder. So typically through the prescription of Suboxone. As a linkage program, our goal ultimately is to link people to long-term MOUD care and take care of viral hepatitis care while they're engaging in their MOUD care. Next slide.
So I'll talk a little bit about some of the community events that we've done. So, our outreach is kind of two-pronged. We have our direct street side clinic from the mobile unit, and then we also work to identify key community stakeholders in each neighborhood before we bring the mobile unit there so that we can start building relationships with the other organizations that are already serving our population of interest, and really just expand our reach. Also with this grant, it kind of has taken us in new directions and even further expanded our services. We in the West African community, so in our West Philly location, there's a large number of African immigrants and refugees, and we have partnered with St. Cyprian Church there and have held 2 large screening events in partnership with the Hep B Foundation as well. We also recently went to the Black August Resource Fair, which is a resource fair that's specific for folks with history of incarceration, so legal services, and just social services as people re-enter to community. We're also working with many of the different food distribution orgs to be tabling while they're doing food distribution so that we can be talking with those folks to be able to provide education and also refer people to our mobile unit for care. Many of the folks who are visiting the food pantries are unsheltered and are not engaged in the medical system at all. And then we're also working currently on building relationships and setting up testing events with several recovery houses, halfway houses, and homeless shelters. So trying to kind of set up like mini clinics within those centers to be able to test large numbers of people at once without them having to come to the mobile unit. So that's kind of, our goal over the next year is to really expand some of that outreach work that we're doing. Next slide.
And here are testing numbers. So since our expansion initiative in December, we've had 41 people tested for hepatitis B. You can see about a third of those were not immune, and 38% of those received at least 1 dose of the Hep B vaccine. Together with that are numbers for hepatitis A and hepatitis C, which included 150 people approximately tested for Hep C, and almost 10 of them started on treatment. Next slide. So ending with successes and challenges and things to continue to work on. One thing we're really proud of is really expanding viral hepatitis services for all. So this has included folks who did not get tested before, or increasingly one thing that's been interesting, with this expansion has been navigating into other spaces and other communities to do testing events. Integrating these with treatment for substance use has been crucial in retention, in terms of meeting people where they're at and giving them the services they need so they don't have to go to multiple places. And part of that has been navigating transitions of care. So our nurse navigator has made lots of calls to people who got incarcerated or people who left from incarceration or went to inpatient substance use rehab, and really made sure people got their follow-up vaccines, which I think is really important to make sure people get their full treatment series. And then, things that we've learned over the past year has been some of the kind of innovations in terms of how people can get vaccinated. One thing we were really intrigued about was an event we did with the Philly Department of Public Health, in which, really trying to expand empiric vaccination if people are at high risk and may be more difficult for them to come back to get subsequent doses. And together with all of this has been part of our work with HIV prevention, which really dovetails with Hep B prevention as well, in terms of getting people's Hep B serostatus and starting people on active agents. Next slide. You know, some of the barriers that we've had were also things that we worked through on our calls over the past year. And so one of those has been venous access and actually, you know, getting blood to understand if people are immune or not, for which we ended up getting a vein finder and are, you know, continuing to troubleshoot to evolve to address some of these needs. You know, folks have complicated lives, especially as they're trying to navigate early recovery. And so we try to support people as much as possible. And then lastly, we currently do not have our own supply of vaccine. We do have a high population of people who are insured or insurable, but these are some of our growth opportunities for the next year to continue to explore how to partner with organizations with vaccine supply, or to continue to do pop-up events, really to make sure we can increase our impact. Thank you so much.
Thank you so much, Dr. Siva and Dr. Fox. Next, we have Richard So from SF Hep B Free talking about their project.
Sure, sounds great. I'll share screen here myself. Let's do this one. Oh my God, how do you, I'm brain farting right here. All right. So I'll try to be quick. I know we're a little bit past. Our project was called Under the Mango Tree. It's really one really focused on trying to reach the Pacific Islander community in the Bay Area. We as an organization have done a lot of work over the past 10 years in Asian communities, but we haven't really had that much luck until more recently, as we looked into reaching the Pacific Islander community, which, as probably many of you know, is often overlooked, under-resourced, and do not interact with the healthcare system, and as a community that we more recently learned often lacks trust in the healthcare system and community, from discrimination and kind of a feeling that they are just seen as you know, overweight folks who don't care about their health. So I just wanted to start with some of the data. Hepatitis B is still a significant threat. This is a 2019 model of those places where most people are emigrating from. And so a good reason why we wanted to work on this. And these rates are actually higher than a lot of East Asian countries now, because of some of the vaccination campaigns that were more successful in East Asian countries and may not have been in some of the Pacific Islander areas. So just really quickly, we wanted to note that we did use a lot of the Hep B Foundation stories in our education sessions. And our goal was broken down into two major things. One, going into Pacific Islander safe spaces and doing a slideshow education, but combining that with a cultural component. And for us, that was using these tea leaves or paper to weave these leis that are used in a lot of Pacific Islander celebrations. And this was a project suggested by my other staff member, Lena, who is Pacific Islander herself. And she was also the one who did the educations. And this, as I'll describe a little bit later, was critical in building the trust. And I think getting people to absorb the education and then do screening than if it was just me coming in and just doing a plain education. So we also shared Cinder's story, and we actually, even in the presentation, talked about how those sharing those stories allowed folks to better see it, the problem that was in their own community. So in our achievements, we worked with 3 to 4 major PI community groups, as well as 5 to 6 major players that were sometimes part of those groups, sometimes just matriarchs or patriarchs. We participated or organized at least 11 PI events. We're very proud with that. That was pretty much once a month on average from the FY 2023 to 2024. Directly educated about 580 PIs of about 3,500 total that we did that year. So a good chunk, a much, much larger chunk than we had done previously. And when we say directly educated, we mean a real at least 3 to 5 minute conversation where we feel like they've absorbed the information. And then we indirectly educated about 1,000 through networks of our PI groups and ethnic media of more than 10,000 to 100,000 that we did, including everyone that we worked with. We screened about 50 PIs of the 260 total that we did in that fiscal year. So again, a decent chunk. I will say these numbers are a little bit lower than what we hoped to achieve in our original application. And I'll go over some of those barriers and why that might be in a bit. So I wanted to show you some of the assets that we were using and the types of things that we were using. So you can see here, there's a Pacifica Health Unity Day that a ton of different organizations, many who are PI, did in May. One of our posters that we made for Under the Mango Tree Education in Burlingame, and then another activity. So we really tried to reach out and find these activities where people were already gathering. Now I'll show you some of the work that we did. So you can see here someone literally being tested at an event. We provide that for free, send that blood to a lab and then have those results sent to them. The middle is kind of our classic education station with these are the money lays, but made with origami paper. And then someone at another event on the far right. This was at a major PI event in the community. And then you can see our staff member here, both on the left side of the pictures, educating one. This is a PI club at a community college. Actually, I think both of these are at two different colleges, in which case she is doing the education. So what were some of the results kind of overall, the outputs? We definitely built and strengthened trust with the PI community that we didn't have before. We now have 3 to 5 PI media partners that we work with each year doing low-cost PSAs through Facebook podcasts and things like that. We built a brand new collaboration with the Tongan Consulate, and we're going to do another event with them, I think, at the end of this year. And what's really great is all of these partners have said, let's work more together. And as part of that, proof of that, there are 4 more events we have planned this year, large scale, even though the year is ending. We really found that the tea leaf weaving, which either used these fresh leaves or the paper, really improved our interaction. It really did seem to build the trust when I was giving. So what we would do is we'd start teaching them that tea leaf weaving or the paper and have some food, and people would be chatting and such. And then 20 minutes in, I'd start the presentation and they'd work on this cultural activity while listening. And you could immediately feel the warmth and kind of the questions that were asked and the screening that was done after felt very different from the way we used to go in, do a presentation from me, even in language, and folks would be sort of listening, but kind of not. So this, we think, is a really great model for folks looking to break that barrier in whatever community they're working on, as long as you have a little bit more of time, because it did make our sessions about an hour 20 long instead of just a 25-minute talk on Hep B. And then one really interesting, unanticipated bonus was that we started doing the money lays across all our East Asian and other communities, and people loved it. People would learn about what Hep B, sit down, or vice versa, see the cultural fun activity, especially with children, sit down, and then we would teach them and hand out the brochures. So it's something that we've expanded across almost all of our events when we have the resources, and it really, really helps, again, with building that sense of community. In terms of our barriers, particularly working with the PI community, we kind of knew this going in, but we need to take into account that it takes more time and prep to work on these events and also to get people screened. We had a lot of issues with folks saying, oh yeah, I'm sure you can get 10, 20, 30 screenings only for us to go to the event and do 5 or 6. That happens quite a bit, but it's kind of a learning curve for all organizations, and it's about building that trust. And then for us, because we are not tied to a specific healthcare system, it's kind of hard. In fact, it's very hard for us to ensure that folks who do get screened with us go into care. So we're working on that. We work with a FQHC called Northeast Medical Services, who we always have their flyers and their locations, but it is still something that we can't track very well. So as I listen to all of your presentations, we do send the results, their Hep B results in the mail, but that's kind of as far as our touch point goes. And so we hope to continue figuring out a better way to try to ensure people get look into linkage to care, or if they just learn from us in the community, that they go and get screened at their own providers. I think that's it.
Thanks so much, Richard. Last but not least, we have Sandra Ashford from HBIDC talking about their mini grant project.
Hi, Margaret, do you want to go ahead and share the slideshow? Good afternoon. We'll start from the first slide. Hi, so my name is Sandra Ashford, and I'm the CEO of the Health Betterment Initiative. We started as Hepatitis B Initiative in 2006, but have since evolved since we're taking more of a syndemic testing approach to underserved communities. And so since 2006, we've been going into Virginia, Maryland, and DC and promoting education about Hep B, Hep C, HIV, and also diabetes and hypertension. Next slide. So a part of this, we're so grateful to have this grant. And so a part of the grant, our project goals were to contact 100 providers in DC, Maryland, and Virginia, and engage them in discussion about the new universal adult Hep B vaccination and screening recommendations, and list 3 new providers in each state, DC, Maryland, and Virginia. I'm happy that Jennifer will be helping me in discussing this in a couple slides down in a little bit. And screen and test at least 100 at-risk individuals who do not have adequate health insurance in Virginia for Hep B, and link those who need the Hep B vaccine to a provider. And we also started providing Hep B testing for high incidence populations, and the Chris Atwood Foundation, which is one of our partners, who does harm reduction in Northern Virginia. And before moving forward, we have had adequate funding in Maryland and in DC, but Virginia, it has been harder to get funding. So we are so appreciative for this grant. Next slide. And now our data manager, Margaret Delaney, will explain the next couple of slides. Thank you.
Hi, everyone. So since basically in the past year in Virginia, we've been able to screen 429 individuals for Hep B. 11 of those individuals were positive. So we're seeing about a 2.5% positivity rate. Largely, though, we're seeing a lot of people that need the Hep B vaccine, about 45%. And our CHWs work with every single client, they call and explain their results to them. And then for those positive clients, we make sure to link them to a provider in our network and so that they can get the care they need. We've had a lot of different events over the last year, but about 200 of the individuals we screened for Hep B came from these 3 events: Arlington Newcomers Health Fair, and then a Mongolian and a Vietnamese community event that we held. Additionally, in January, we started working on a new database for the organization, Apricot, and we ended up implementing it in Virginia in May, and that's been able to really expand the data we're able to collect. So a breakdown of the positive clients that we've screened, we're seeing about equal proportion of gender. But we are seeing more individuals that fell in that 40 to 49 age group. And then really importantly, 64% of the people who screened positive for Hep B didn't have health insurance. So we make sure to work with them so they can apply to either Medicare, Medicaid, or whatever they may need. And then again, like I said, since we had the largest proportion of our clients come from those 3 events, we can see that many of the positive clients came from those events as well. And we were able to provide translation services, particularly for the Mongolian and Vietnamese community as well. And then our harm reduction efforts with the Chris Atwood Foundation. So they provide recovery services and housing services, medical services as well to the community. And that's where we're doing that syndemic testing approach, testing for Hep B, Hep C, HIV, and syphilis. And we have not actually seen a lot of Hep B positive clients in this community, but we are seeing a lot of Hep C clients, 30.9% positivity right there. And we're still seeing a very high need for the Hep B vaccine. So we're making sure to make those referrals as well. And these clients are more at risk, being low income, as we can see here. And then a lot of them aren't very well connected with the healthcare system. 46% not having a primary care physician. So we try to help with that as well. The great thing about working with the Chris Atwood Foundation is that since they do have healthcare providers themselves, we're able to make a direct linkage with our positive clients that we find there. So we really make sure that they're getting the treatment they need.
Yeah, and this all happens in Virginia. So this was a good thing with the grant. And also they help with like case management. They just don't have the capacity for the testing. So that's where we come in. So we've been grateful for the funding. Next slide, Morgan. Okay, now I'm going to go ahead and introduce Jennifer Galdames, who handles Virginia outreach. Jennifer?
Yeah, hi, my name is Jennifer Galdames, and then I'm do the community outreach and also do the link to care for those clients where they test positive or they need the vaccination. With this grant, we successful outreach over 100 providers in DMV area to facilitate for them to do the Hep B vaccine to do client. We also provide this provider with GSK voucher for allow the provider to give to the patient the free Hep B vaccine. We also connect to 9 different providers in DMV area for infectious disease. They can able to treat the PIWIC community and the client without insurance. And we successful getting 3 happy patients to the one provider they do, and then with the free testing for them, additional testing, and get them treatment. And I also we also getting the vaccine for the client, and then the provider able to give the patient. We know they have the new vaccine coming out with the 2 doses, but GFK they provide 3 doses for the client, and then we getting about almost 20 patients. They're able to get the free vaccine for one of the providers for church. I think that's all.
Thank you, Jennifer. And just a side note on the vaccines too, we do syndemic testing in DC shelters, and Jennifer has been successful at identifying those individuals who need vaccines and bringing, as we're doing COVID vaccines as well with a partner, they also are doing the Hep B vaccines for those residents at the shelters. So thank you, Jennifer. So sustainability. So as we are grateful, so what do we do next? So funding has helped make HBI known in Virginia. We were known, but not to many avenues. And so moving forward, we received the grant from Potomac Health Foundation to continue syndemic testing in Prince William County. We were also subcontracted to do insurance now for Virginia residents and the underserved, specifically our way to reach different communities that speak different languages. And with this, as well as we're helping them get insurance, we're going to educate them on viral hepatitis, as well as the importance of getting vaccinated. So we're just so appreciative to the Hep B Foundation and to Frank and Shreya for their support as well. And we're going to continue to educate and screen in the DMV area. Thank you.
Thank you so much, Sandra, and thank you to all our panelists for their wonderful work and for their presentations today. Thank you to all our attendees for having the patience and being flexible as we've gone 20 minutes past the hour. If you have questions again about Happy United or mini grant program or questions to any of our panelists, please send that to me and I'll make sure to get your questions answered. Having said that, we hope to see you for our next webinar and hope you all have a very good evening. Thanks so much, everyone.
Thanks, everybody.
Thank you.
Bye.